So you might want to know how radiation works so successfully. If you think about it, cancer is a destructive disease of almost any organ of the body it can go to, especially bones. And so we treat a lot of bone metastasis in radiation oncology. And in so doing, spines are treated, shoulders are treated, hips are treated, lumbar spine going into the sacrum is treated frequently because disease tends to go to these sites. Well, same thing happens in arthritis. They go to the main joints and they cause severe pain for the patient. When we were treating the patients with bone cancer, they would have destruction of the bone. And the radiation literally would go through that tissue, and it basically would activate the water molecules into perhydroxyl radicals, which attack the DNA by grabbing electrons off of the DNA. As it destroys the DNA, so goes the cancer cell. It's destroyed. So you might say, well, in arthritis, what does it do? And the answer is it destroys the inflammatory component of the arthritis. Your joints, as you grow older, oftentimes are attacked by macrophages who cause an inflammatory response in the joint. They may destroy bone, they may destroy the joint, they may destroy and activate tendons, they create spurs, bone spurs that go into the muscles. All of these lead to pain. And when radiation is given, it basically destroys those macrophages and the areas tend to heal. The best explanation I have for relief of pain is that in the destruction of the macrophages, it also eliminates a substance called TNF, tumor necrosis factor, which is a peptide that is secreted by the macrophages to stimulate the nerve cells. And it does this to try and prevent you from moving your joint because the joint is inflamed. So when you do the radiation, the bottom line is the joint inflammation disappears, the pain goes away, the mobility increases, and if you had a chance to look at all my testimonials, you'll see that I have examples of C-spine treatment, shoulder treatment, knee treatment, hip treatment, treating of the hands. You can treat any inflammatory condition that is created. And this, by the way, is being used in Europe a lot. In Germany, for example, they treated 6 fractions, 50 centigrade each, and they wait a couple weeks and they may repeat 6 fractions. I tend to go a little faster in a higher dose because I find that it's more effective and it lasts longer. In the German studies, it seems to last a year or 2. In my personal case, I can say that it's lasted for 15 years in my knee and for 10 years in my C-spine that I treated. I've treated numerous patients in numerous areas. It will destroy the bone marrow in that area, very temporary, and the bone marrow comes back. It's not going to be affecting your body's white blood cell count or your red blood cell count because it's not taking out that much bone marrow. The treatments are painless. They take about 5 minutes to treat you. You get 3 treatments a week usually, and a total of 4 to 6 treatments, sometimes even as high as 8. It all depends on the amount of destruction and the amount of pain that is going on and how long you've had it. The more chronic the disease, sometimes it's a little harder to control, but actually in that case I tend to go a little higher and I tend to get good responses with most patients and get relief of pain and get better mobility.